My name is Cassadie Moravek, and I am the Associate Director of Scientific and Medical Affairs for the Pancreatic Cancer Action Network. I've been with the organization for just over 9 years and really have been focused on providing support to patients, caregivers who've been diagnosed with pancreatic cancer. And the organization overall provides patient support, provides patient outreach and advocacy, as well as awareness for pancreatic cancer. Patient advocacy groups are usually focused on a particular medical condition, and really they provide support for patients. They're a source of education and resources for patients and family members affected by a disease. And they really are important because they help patients understand the medical condition that the patient's been diagnosed with. They can help patients understand the terminology, what questions to ask the healthcare team, and really just be that guiding source and part of the patient's multidisciplinary team, really, when they're facing a diagnosis. So for those recently diagnosed, just know that you're not alone and there are resources out there to help you. Patient advocacy groups are a wonderful resource because the internet can be full of information, sometimes misleading information, so definitely patient advocacy groups can be part of your team to help you find trusted resources and really to be that guiding light for you and provide hope and support during your journey. So when patients receive a diagnosis of any kind, sometimes the information is overwhelming. And so really patient advocacy groups can help patients find information on just the disease itself. So understanding the disease, what is happening, what they're going to be facing. We can also help patients actually find support resources. So a lot of times they just want to connect with someone who is going through what they've been going through, talk to others in a similar situation. And so patient advocacy groups can actually help patients with that as well. Another really important thing for patients who are overwhelmed is just knowing what questions to ask. So we can actually provide information to patients on, here are some key questions that might help you in the conversation with your doctor and your healthcare team to better understand your diagnosis, what treatment options are available, and really helping patients to make informed decisions for their care. So there are many different types of support groups for patients affected by many different diseases. Some of them are online, so if you're more comfortable in an online forum, there are online support groups available where you just provide basic information, usually an email address, just to be able to communicate with others in your type of situation. There are also in-person support groups that are available through nonprofit organizations or even at your institution where you're being treated. So there really are support groups that can meet patients where they want to be when they're wanting to get support. Organizations like ours also have peer-to-peer matching where we're able to provide one-on-one matching for someone in a very similar situation where patients can reach out by phone or by email to be able to talk to patients in a similar situation. There are also support groups that are phone support groups that meet every month, so you can actually just pick up the phone and have a conference call with different patients and even caregivers in a similar situation. So there are a number of different activities that patient advocacy groups have. Many of them do run walks to raise awareness for their particular disease. So that's one way to get involved and meet others. Other advocacy groups have affiliates or local chapters where you can also meet up with people. So in addition to the support groups that are more structured around supporting the patient, there are ways to get involved with organizations and to meet up with people outside of that support type of network where you can actually raise awareness and interact with people in different ways. Patient advocacy groups definitely can provide listings of doctors and specialists that specialize in any particular condition. The Pancreatic Cancer Action Network actually maintains a list of doctors and surgeons who specialize in pancreatic cancer. So there are advocacy groups that maintain those types of listings, and if they don't, they usually know the resources where to send you to find those types of trusted medical professionals. Often patient advocacy groups work with leading surgeons and doctors in the field of the medical condition that they're specialized in, so they also have those types of connections as well where they know who are the leading experts in the field.